Good evening. I'm Dave Vitito. I'm the Executive Director of Alumni Relations at John Carroll University. I'm also a member of the class of 2000. It's great to be with you tonight virtually. With these times and all that's going on, we had to find creative ways to still bring John Carroll to our alumni wherever they are. And we've really hit the ground running with this webinar series. So again, thank you for being here tonight. Just a little background, the Alumni Continuing Education Series, or A.C.E.S for short, was established in the spring of 2013 by the Office of Alumni Relations in the spirit of lifelong learning. The program offers enrichment opportunities for alumni and friends through the expertise of the members of the JCU faculty and alumni community. And again, this year for the first time, we're going online. And with over 300 registrations for this series, it's safe to say our alumni have responded. And again, we're excited to introduce to you our presenter this evening. He is a professor in our history department, an author, and a researcher whose work has focused on the religious and cultural history of Italy, as well as the Jesuits in Italy. In addition to his work in our Department of History, he serves as the director of the Institute of Catholic Studies at JCU. And as an aside, and I went through my archives, and if I'm not mistaken, Dr. Murphy was actually the very first lecturer/presenter for our A.C.E.S program back in 2013. And at that time, it was shortly after the papacy of Pope Francis began, and he presented on what was to come with the first ever Jesuit Pope. So that was a big deal in our circles back in 2013. And a year later, Dr. Murphy led our very first alumni travel program trip to Tuscany, and I was blessed to co-lead that trip with him. And I'll just say before I step aside here, how grateful our entire team is in Alumni Relations for Paul's willingness to collaborate with us in service to our alumni. He has always understood the value of alumni engagement and the importance of a vibrant alumni community. With that, I'll turn things over to Dr. Murphy, but please remember to enter any questions you might have for Dr. Murphy in the chat feature as we go. You can enter at any time, and I will go through the list at the end and make sure we try and get through all the questions that are posed to Paul. And for the sake of all of our listeners and the presenter tonight, please remain on mute throughout the session. With that, Dr. Murphy, the floor is yours.
It's good to be here, and it's been kind of fun to see the names of all of the participants start to appear as you enter the waiting room or join the group, as I see many old friends, some not so old as the others. It brings back many memories of times on campus and times traveling or at other alumni events. I always like to tell John Carroll alumni that the one reason I'm really jealous of you all is that you have a degree from John Carroll, and I don't think I ever will. It's great with you, and this is, I must admit, a part of my ongoing training in how to work online. We are all facing challenges at work in many places and here at John Carroll and in many other schools in terms of delivering learning and teaching to our students in many places. This semester was quite interesting to meet my students via a Zoom chat. So in any event, my job tonight is to share with you the experiences of a John Carroll study abroad group in Rome in February and March of this spring, just as the coronavirus crisis was reaching a peak actually in northern Italy, and how the university responded to that, and also how the church, the Vatican and the church is responding to this issue of how to continue to live as a community of faith during this time. As many of you know, I'm a history professor, and every other year I teach a course on the history of the city of Rome. That course is designed in such a way that we spend the first half of the semester in a classroom at John Carroll, and then we go to Rome itself for spring break. And during that time, we use the city of Rome as our classroom. So essentially, we are on our feet, walking through Rome, visiting churches, museums, and archaeological sites for about 9 days. This year, we were scheduled to leave on the 26th of February, just at the beginning of spring break. And I have to say, by that time, there were stories of difficulties in far northern Italy, not in Rome itself. And you should know that the university took this seriously even before we left, but the threat designated by the U.S. State Department had remained low for Rome, and Rome was the only place we were going to be visiting. Consequently, we arrived in Rome on the morning of the 27th. We spent a day there and then went to sleep. And when I got up in the morning, there was in fact an email from John Carroll in that we were to return to the United States as soon as feasible. In other words, as soon as we could get airfare. Because it turned out that the day after we left, the US government did raise the threat level. So there we were, about 25 of us in Rome, working out both how it was to study in Rome in the midst of a major global medical crisis, and at the same time get home. And I'm very grateful for the John Carroll people who work on crisis management and who work in global education, who worked very hard to get us home safely. In fact, our trip was not cut short very much, only by a couple of days. So in fact, our students were actually able to have a real educational experience while there. And during this time, of course, as I say, we got to see the Pope coming to his window during on a Sunday morning. We visited the Sistine Chapel. I must say that what was different this time was that the longer we were in Rome, the number of people who were there declined dramatically. So visiting in museums, for example, was much different because usually it is a very, very crowded place. When one is ordinarily in the Sistine Chapel, you're standing shoulder to shoulder with people and you're grateful that the thing you really want to see is straight up above. So you're craning your neck to look up. But in this, what we found is that the Sistine Chapel was probably at about 20% capacity while we were there, which made it wonderful to see the Sistine Chapel, but started to give a rather eerie sense that something very different was afoot in Rome. And I think our students benefited from this, not only usual sort of artistic, cultural, and historical sense that they were able to enjoy these places in a less crowded manner, but I think they began to realize how small a world it is and how interconnected we are. We had a wonderful experience during that time. We concluded our trip, as we always do, with in the rooms of St. Ignatius of Loyola, the apartments next to the Jesuit church, where in fact he wrote the constitutions of the society, where Ignatius finished the spiritual exercises, and where in fact he died in 1556. And a dear friend of mine, a Jesuit in Rome named Robert Geisinger, said Mass for us, as was his custom. Always have him say Mass for us right there, and then we went out to dinner. That was on the evening of March 3rd. We came home and were scheduled to leave on Thursday, March 4th. And that's where things got a little tricky. By this time, Rome had been emptying out, as I said. I mean, I remember one afternoon walking into a restaurant in downtown Rome, and I was the person in the dining room. I've never had that experience. So on March 4th, we go to the airport, and it turns out that effective that day, the US government had insisted that Italian health officials check the temperature of anyone getting on a plane for the United States. Quite reasonable. As it turned out, one of our students had an elevated temperature, had a temperature just above what was permissible. And it's my custom always to be the the last person in line getting on the plane because I don't want to lose anybody. In this case, the student who was just two passengers in front of me was taken off at the very last minute because of this elevated temperature. The Italian health facilities were constrained to remove him from the flight, and of course I couldn't leave him there. John Carroll doesn't do that. And so I stepped aside and stayed with him. At that point, we were told that he had to see a doctor, brought to an ambulance on the airport grounds. They tested him, and they said that he had to remain in Italy for 5 days. So essentially, his quarantine and mine began on Thursday, March 4th. At that point, our plans were all thrown off, and essentially what we had to do was stay in a hotel near the an enormous Holiday Inn, I have to tell you, that seemed to be running at about 5% capacity. I think the only people in the hotel were those who were trying to get on a plane. I called the U.S. Embassy, and it was interesting to me that the embassy itself was unaware of this new regulation that travelers had to have their temperatures taken, helpful insofar as they could be, and therefore we had to wait this out. We got the student a doctor. It turned out he had something that was not COVID-19. He was not sick with that. It was some other kind of infection. And so with treatment, that came down. And after the 5 days, he and I were able to get on a plane. So that was quite an adventure, actually getting out of Italy. At first, it seemed as if it was just going to be a quiet time, and then we began to see everything else closing down. When on that Sunday, I started watching professional soccer matches in Italy, and they had already shut down the stadiums, and there were no spectators there. You knew things were very different. And then the morning we left, the government of Italy had basically shut down all of northern Italy. And soon after we returned, the entire country went down in lockdown. And I believe it was within a few days that the U.S. government was shutting down traffic, Europe and Italy in particular. So this was quite an interesting adventure for us. We'd never had an experience like that. The trip went very well. Our students are all healthy. None of them appear to have contracted the virus. Of course, who knows if any of us were asymptomatic. I've certainly been fine. And we all went into a quarantine. All of the students, even those who returned as scheduled on March 4th, went into a quarantine that lasted 2 weeks. Mine began after that. And of course, when my 2 weeks was up, the state of Ohio decided to shut down. So it has been an interesting adventure. This situation, however, presented challenges as well to the Vatican and to the Church. In early March, the Vatican closed all of the churches of Rome and the Vatican museums, as the government also closed down all of the museums that were operating in Italy. And as I'm sure you've seen from news stories, Italy was basically abandoned of the tourist industry, which of course is a real challenge economically to Italy. I think about 16% of its GDP is based on the tourist industry. And of course, the issue then becomes, how does the church minister to the people of God in a situation in which public masses are not being celebrated? As you know, this of course happened in the United States as well. In Italy and Rome in particular, many churches were left open for private devotions, but masses were not being said. The same, of course, happened here. It should be said and recognized that the reason the church did this was really for the well-being of individuals, and well-being of individuals. It was not out of fear so much, but a recognition that great crowds gathering in St. Peter's Square or in St. Peter's Basilica could quickly become places from which this virus could spread rapidly. And since the first commandment is to love God and your neighbor, the Holy Father and church authorities have been following that for that reason. Something, of course, that's been quite difficult for many people. The last time I attended Mass myself was that March 4th in the rooms of St. Ignatius. I didn't know that then, but I certainly miss going to Mass. But I'm fully aware that this is a challenge. Now, of course, the Vatican and the Church are reopening. St. Peter's Basilica has reopened for Masses in the last week. The Vatican museums are reopening. The churches of Rome are reopening, and as you know, here in the United States, dioceses around the country are making plans to reopen. All, it seems, with varying plans for ensuring the well-being of the people who will be worshiping. I can tell you, I really have a great deal of respect for the way in which many of the bishops of the United States have approached this. Archbishop Gomez of Los Angeles spoke eloquently to this the other day. So did the bishops of the state of Washington. And of course, the challenge is, how do you gather people together and still maintain adequate space? I must admit there are differences in terms of what that will mean for different dioceses. Many of you are still living in the Diocese of Cleveland, where the diocese is permitting up to 50% of a church to be filled. But of course, in some spaces, that wouldn't work with people still being able to maintain a distance of 6 feet. So I think many churches are still doing this out as they go. They're trying to keep the places clean. They're taking great care to ensure the health and well-being of others. But I don't think we've seen the end of this yet. My wife is actually on the staff of a Roman Catholic parish here in the Diocese of Cleveland, and I know they've been working very hard because she seems always to be in a Zoom meeting like this. And I know that the pastor and his staff are taking the concerns, the spiritual and the physical concerns of the people very carefully. It does seem to me at this point, we have had an opportunity, however, to experience ourselves as Catholics and as a church in a way that we've never experienced before. One of the great things about being a Catholic is that we don't rely only on our gathered worship services. We are people who have a tradition of prayer, spirituality, ritual practices that can go on in the home that have allowed the church to experience what's sometimes referred to as the domestic church in a way that Catholics perhaps have not experienced in a long, long time. I can tell you it has been a moving experience in my own household for my family and I to gather, especially on a Sunday morning, for our prayer with the church, according to the prayers of the church, with the readings of the church, my daughters and my wife all together. It's not the same as being in church with the entire people of God, but it's a very powerful experience. It is I think, for many of us to take stock really of what it means to be a member of a community, whether it's an alumnus who's a member of a university community, whether it's a faculty member or a student. There is much that still faces us, or that we still face. As we get ready for the fall, as many of us have to admit, as you can see, I'm a gray beard, and I have to say teaching online was not something I was prepared for, but the university and our faculty are working very hard to ensure that we are ready for the start of classes in the fall in whatever shape that's going to be, face-to-face, via Zoom, synchronous learning. But I do think that we have learned what it means to be community in a way that would not have been present to us had this not all happened. So I have to tell you, when I was in Rome and I was with my students, and to see the maturity with which the situation they were in, and the learning that they were experiencing in terms of seeing what's going on in Italy, or what was going on in Italy, made me very proud to be a faculty member at John Carroll. It made me very proud to be involved in this enterprise, which is the education of youth, the formation of youth to build a world that is ever more loving and just. And I think that's really what happened when we were in Rome. I think that's obviously it's what we're seeing with first responders. So all of us play a role in this. And so I guess when you finish it, I'm always reminded of a line. Jesuit English professor at Fairfield University, where I attended. And every single semester, he would finish class by asking the students, now, he would say, how do you live with what you know? And I think that's really what I want to ask of my students, and I would ask it of my colleagues as well. I'm very happy to take questions if people have any questions about this experience, if there are things I've left out. It's a very powerful experience that we've had, and I'm just very grateful to Dave Vitito and the Alumni Office for inviting me to meet with you in this way. Dave, what do you say?
Thank you, Paul. I'm logging back in here. Hold on a sec. I think my video will queue up shortly. Can you hear me?
Yes.
Great, great. Thank you again, Dr. Murphy, for everything. Fascinating. I think we all were wondering, that period of time, just how different and unique it must have been from your past trips with our students. And I really thank you for touching on the role the university played, decision makers, how that all factored in. I know you and I had talked before about, hey, when I don't want to say when you were permitted to go on the trip, but before you left, the threat level was not high, and we did not know this was going to happen, and everything has moved so quick ever since, frankly, that you were there by the time we really knew what was going on. We had all the information at hand. So I thank you for touching on that a little bit.
Can I just say an important point? If the threat level had been raised 2 days earlier, we probably would have never left Cleveland. But so the university did act with a sense of purpose and decisiveness when that became clear. And of course, that just meant we had to come home 2 days early, and thank God we were all well. It was very quiet in Rome, but we were all safe.
Okay, the questions are starting to roll in now, and please ask away, everybody. The waters are warm, so we'll get through as many as we can. The first one I think we really just touched on, which was the confusion of why the group stayed when JCU said to come home on day 2 of the trip. And I think you had touched on that. It took a little while to actually make travel arrangements and so on and so forth, but anything else to add there?
No, I think, as I say, I think that global education worked to get us on the earliest available flight. And as it turned out, that worked out fine. But so it was just the last couple of days of the trip that got cut off.
Okay. Thank you for that question, Catherine. From Jill Robinson, what is your favorite spot to visit with your students during a normal trip to Rome?
It's really difficult. I have been visiting Rome since 1977, either as a student or a faculty member. And I just fell in love with the city that long ago, and I just can never get enough of it. It's very difficult for me to say what is my favorite place, but I do to see my students when I take them into a church called San Clemente, which is a Dominican church that is a medieval church on street level, built above a 5th century church below that's been excavated, which is above a 1st century Roman home and temple. Go all the way down. By the time you get down to the bottom, you're probably 100 feet below street level. And to see the look on your students' face when they realize that they are truly deep in the bowels of ancient Rome is a great experience. Of course, there's nothing else. It's also wonderful for them to see things like the Sistine Chapel and the Church of the Jesuits.
Okay, from Dave, not me, another Dave. Would you share your perception of the steps taken by Italy versus those taken by the state of Ohio?
Italy clearly faced a sudden crisis that no state in the United States faced, as far as I can tell. Now, I'm not an epidemiologist. I think the fact that, I mean, we benefited from having seen, unfortunately, what happened in Italy. I think Governor DeWine did a very good job, but, you know, the Italians didn't have the experience to, excuse me, we had an experience that the Italians did not in having seen what happened in Italy. When they did so quite stringently. It was a complete lockdown for very few reasons. Was one allowed to leave one's home for a couple of months, but then they were facing a terrible situation around Milan, Bergamo, Venice, Genoa, in areas up there. So I'd say they did a good job, and I think Italians themselves rose to that occasion. And although there was some concern about it, I don't think you saw pushback on that the way you see pushback by some in the United States. So I would say Ohio, at least I'm glad to have been living in Ohio, because I think we did a very good job here of reducing, or what we call it, suppressing the curve or pressing the curve down through the closures. Of course, now we have to negotiate a reopening, and what does that mean? As I said, it's easier to close churches than to reopen them. And what will that mean when we're milling around in public places? But I think we did a good job.
Just to interject, Paul, we have a few more questions that have been posed, but just kind of struck me, you know, the epicenters of the virus here are, you know, New York City, places like that, where people are living right on top of each other. And that's similar to many cities in Italy, the big cities, right? Rome, Milan. How has it impacted the rural areas of Italy, the small villages, you know, in Chianti?
I think from my reading of it, it has not impacted them as much. Although there is a kind of, the lockdown in Italy affected the poorer southern parts of the peninsula, which is not a surprise in a certain respect. Southern Italy struggles with economic issues in ways that northern Italy does not. And so much of the economy of southern Italy is what's sometimes referred to as an unofficial economy, an economy off the books, that many of the people who lost their jobs with the lockdown there didn't have the official paper trail in order to get the kind of unemployment benefits that workers in the official economy were able to gain. So I think that there was a good deal of frustration in those places in Italy for that reason. That's not necessarily rural, but it certainly is regional between the north and the south.
Thank you. All right, from Terry Lewandowski, if you were to take another group, how would preparations differ given this experience? And you do plan to take another group, maybe next year, certainly after that when things normalize, but I know you'll want to go back. So how will things differ?
Well, first I want to say hi, Terry. Nice to hear from you. Is that a request to come with me? You know, that, we can do that. I hope to go in 2 years. The history department has a couple of different courses like this in alternate years. Professor Matt Berg and Professor Andreas Sobisch of politics take a group to Berlin. So not next year, but the year after that, I hope to go again. Certainly, to be honest, we're going to have to always be looking carefully at health issues and security issues more carefully than we did in the past. Hopefully we won't be facing this, but from what I read, we could be facing potential for pandemics in the future, and we just always have to be aware of that. I think we did a very good job. The insurance coverage the university insists upon for individuals is been very helpful already. There's no doubt that we would get out of a situation like that. So I think that we just continue to do the careful planning that we've always done. We don't leave things to chance anyhow. So I think you just continue to do that. So I do plan to go back. Even in my my elder years now. I have to say my knees hurt more at the end of the week in Rome now than they used to.
All right, the next question is from Paul Holzman in Chicago, and it is relative to what's going on in Illinois. So he says, in Illinois, local independent churches seem to be leading the charge to reopen ASAP, while the Archdiocese of Chicago is going along with the governor and the mayor. Any idea how the Vatican is pushing this decision, or is it a local decision?
Again, hi, Paul. It's good to hear from you. As a native of Chicago, I follow those things fairly carefully. That is a local decision. It seems as if the bishops of the United States are all acting pretty individually, making their own decisions, or perhaps they're making decisions on a statewide basis. The phrase that was used in the question is independent churches are pushing to open this. I think it'll be interesting to look at this to see which churches pushed for this as if it was an absolute necessity, come what may, and those churches that said, do this right and take our time. It does strike me that mainstream Protestant congregations, let's say United Methodists, Episcopalians, Lutherans, and Catholic churches, want to make sure that when they open, they're not crowding these people into these worship spaces. Some of the churches that have pushed hard for this seem, I'm not sure why they seem to be carrying a theology in which they believe their faith will protect them from physical illness. And certainly they have the right to feel that way. But I'm actually kind of proud about the way in which American bishops have, by and large, shown great concern for the physical well-being of their, that when they do this, that they do it right. It's interesting that in the state of Texas, where the openings were permitted, a Catholic church run by Redemptorist priests reopened and then soon had to close when one of the Redemptorist priests, in fact, died, and a number of the members of the community got the coronavirus. Don't want this to, in fact, create new outbreaks. However we do it, we have to do it the right way. So I don't know if it's exactly the case that the Cardinal Archbishop of Chicago is simply doing what the governor wants him to do. I think what he may be saying is, as a church, to be concerned about the whole well-being of the individuals in the communities, and he wants to be a part of the solution. I hope that answers the question. I don't know.
It's a great question too. Thank you, Paul, for submitting it.
Yeah, thanks, Paul.
Next question is from Renata, and I think it's a good one. As you look at kind of where we are here in the States, were Italian locals concerned of those still out and about when you were there? So, similar type of thing. People were coming inside and sheltering in place, but I'm sure there were some people who said, I'm still going to go out and do my thing. What was the reaction there?
It was interesting. When I was in Rome itself, and the epidemic or the pandemic had not hit the city of Rome yet, many Romans at that point thought that there was too much overreaction. The lack of tourists coming to the city was hurting the economy, and many of them wished people would still come. The first night we were in Rome, when we arrived there and we were having dinner, and we customarily have dinner many nights in a little convent that provides inexpensive meals, family style, for pilgrim groups. The nun who runs the place thanked us for our courage for showing up. In fact, we were there. And certainly a tour guide that we work with in the Vatican felt the same way. On the other hand, I do believe there was a growing apprehension as the days passed. I can remember walking into a cafe one time simply to get a cup of coffee, and the man standing at the bar looked at me partially with some satisfaction that there was at least somebody there to spend money, and yet at the same time somewhat concerned that I might actually be bringing the coronavirus right into his place of work. So there was a kind of both a gratitude that we were there, as well as a kind of apprehension that we might be the bearers of bad health, ill health. So I think it had not yet hit, and then of course it got worse around the time, well, in the last few days that I was waiting to leave.
Okay, we've had several questions submitted privately, some to everyone publicly. So private question here from Brianna. After your COVID experience on your trip this year, what's the second craziest thing that's ever happened on a Rome trip with our students? Anything even close?
Nothing is.
I doubt it.
Nothing has ever come. We, to be honest, I'm very grateful. We are this going on for a long time. I'm very grateful for those that I've worked with on this, not only in the university administration, but also my administrative assistants for the last 15 years. It really runs like clockwork at this point. The craziest thing I could say that happened otherwise was not a bad thing. It was when one of our students about 6 years ago, just after Pope Francis was elected, held up one of the John Carroll T-shirts that said, "We love Jesuits." He turned to her, gave her the thumbs up, and asked for the T-shirt. So actually, one of the John Carroll T-shirts is actually in the collection of Pope Francis. I don't know whether he wears it, but maybe when he was in his lockdown, I don't know. But nothing like this.
That was a special moment. I'm sure you comment here, not a question, but John Cunningham would like you to know he's happy to go on upcoming trips, and want to know if you noticed his Italian hat he was donning tonight.
Briefly, I saw him with the hat, and I wished I brought my matching hat to the table here with me.
All right, from Chuck. He wanted to know, actually, this is a private thing too, offline. He has a restaurant recommendation for you near the Pantheon. So I will share that with you after. That's not a question. I will share that with you after, or Chuck can directly with you. But from Jay Hunt, did church leadership react differently than previously, say 1918 or 1968? And is that the Francis effect?
To be honest, and did you say 1968 as well?
That's the question, yeah. Is that
I honestly am not quite sure of that. I think the situation in 1918, of course, was very severe in many places. And we've heard lots of stories about different cities around the country, but I honestly am not aware of that. And of course, the problem with the 1918 epidemic was that it was in the middle of World War, when at least in the Vatican, of course, there was all the concern about what was happening, for example, in the Somme. And that was one of the reasons why it was so widely forgotten. But I really can't say exactly. Of course, our knowledge of viruses is not my personal knowledge, but science's knowledge of viruses is so much more advanced now than it was then. The reaction would be different. It's interesting, if I can go back further, since I'm a Renaissance and Reformation scholar, there were some people who were quite skeptical of the church's closure, who thought that the church was abandoning its responsibility to provide the sacraments for the people and all spiritual solace, and they would point to St. Charles Borromeo and his work in an epidemic in Milan in the late 16th century. But of course, St. Charles Borromeo was not aware of modern germ theory or viruses or bacteria, and so he acted as a 16th century would. To a certain extent, that question that I said that this Jesuit English professor always asked his students holds true for the church today too. How do you live with what you know? And if what we know is that this virus is extremely viral, that it spreads rapidly, and that it is much more fatal than the ordinary flu, then we should be cautious about it.
Great questions rolling in, everybody. Katie chimed in, wanted to make you aware she's on. She's the one who took that photo of the JCU T-shirt.
Oh, great to hear you here. Yeah, that was a wonderful moment.
It was. From John, many Italians depend on grandparents to care for children. Now that parents are returning to work and daycare not available, what are your thoughts about the impact on the culture with the grandparents unable to be there?
That's a great question. As people study this, they are looking at how cultural realities impact the spread of the virus in different countries. And of course, one of the realities is that Italy is a country where you have many elderly people still. In other words, it's one of the oldest nations demographically in the world. But it's also a nation where, in fact, multiple generations are living together in apartments. And that was actually part of the issue to begin with. And then now, of course, when we reopen, how are they going to take care of these people? We have not begun, I think, to see the impact that this will have, not only on us here in the United States, but in every country around the world. So it's a great question. I'm not sure exactly how but of course that's going to be true everywhere, isn't it? How do we take care of kids? How do we take care of the elderly?
Thank you, John. Good question. A question submitted privately, actually, from my colleague, and I had the same question, so we're thinking along the same lines. Could you touch on how sacraments will be delivered moving forward, at least in this period? The Eucharist, distributing the blood of Christ. How does this work?
Right. It appears, and as I say, every bishop in the United States is doing this differently, but it appears, for example, that at least for the time being, sacred blood will not be shared among the community. People won't be drinking from the same cup. In other words, the chalice will not be shared. Only the priest will be taking that. The hosts will be distributed, I guess, with people at a distance from one another. And there are varying directions being given on whether or not wearing rubber gloves when they do that. Of course, there's also what's interesting to me is that what's come back into the fore is the question of how one receives communion, whether on the hand or on the tongue. And there is, I think, probably a fairly majority of Catholics who still prefer, for reasons of devotion, to take the host on the tongue. In fact, I was told today, Mass began for the first time today at Jesuits Parish. And one parishioner was noted by one of the staff members as having taken communion in the hands, even though that person usually liked it on the tongue. And the staff member was very grateful for the generosity of this person, who was willing to avoid any possible infection of others or herself. But it is difficult for people. On the other hand, it would be certainly much more difficult to spread the virus by taking the host on the hand than on the tongue. That will be one of the issues. And of course, all of the other issues surrounding confession and reconciliation. Since the beginning of this, the Church has made clear that general absolution, that is the kind of absolution where priests can offer it to an entire community at one time rather than hearing their individual confessions. Something most often reserved for the battlefield, for soldiers before they go into battle, but this is actually acceptable by the Church and has been made available to people. That continues, I don't know. But the masses will be different. I mean, for example, in most places there will not be music because sort of loud and vigorous singing could in fact expel the droplets which in fact spread the virus. So I think many masses for the time being are going to be quite quiet. What we used to call years ago, a low mass, a very quiet mass. So yes, there are a lot of, and I think, with priests I've spoken to, I think as we reopen, things are being done somewhat experimentally to find out what actually works. And part of it's going to be how many people show up. Most people, in fact, bishops all over the United States at least, have maintained the exemption from having to go to Mass on Sunday because they don't want, especially elderly people who might have compromised health situations, to feel obligated to go to Mass. They ought to know God loves them wherever they are. You, Dave.
Great, thank you. It's a question I've had, and I know it's been talked about, but I wanted your take on it. More shout outs for Katie here and taking that amazing photo. Good for you, Katie. Paul Holzman chimes in one more question, and this is more kind of wearing your faculty hat, administrator hat. His experience, what he's hearing, he has college-age children. Students are contemplating taking a semester or a year off because they don't want the virtual experience. They want the real traditional in-person experience. So why not take a year off and come back to it? What's your reaction to that? What are you hearing? How's John Carroll dealing with that?
Yeah, that's a great question. And I think if it was simply the kind of online learning, I think I'm very grateful I'm at a place like John Carroll. I heard of a friend's daughter who was at a large state university, not in Ohio. I'm not talking about anything in Ohio, where everything was being done online, even with Zoom or without any kind of contact with the faculty member. You simply received assignments and then turned them in, and that was it. And I can imagine students not wanting to do that. What we're hoping to do with a high flex model, a highly flexible model, is to provide a situation where, while maintaining safe distance, some students at least can be in the classroom and have face-to-face experience. Others can simultaneously be involved on a Zoom call. And then others could also take part in sort of already prepared and recorded materials that I will be preparing. So in fact, I think faculty, for example, are a semester in which we're going to be doing a lot more work per course than we ordinarily are doing. And this will be a challenge. And, you know, the students will be coming back and we have to find a way to keep them safe. And everybody has to make this the right decision for themselves. How comfortable do you feel having your child in college? How comfortable do you feel going to college? I can tell you that I watched one of my daughters who's going into her junior year at another Jesuit university finish up her semester at our dining room table. And I think it went okay for her. I'm not sure how that would work for a whole semester, but we'll see. I think it's a great question, Paul. And I think if I were a senior in high school, I might seriously consider that. But most often, I mean, that is to say, consider a gap year, for example. But ordinarily, a gap year entails going someplace and engaging in some kind of internship. And I don't know if the reason is they don't feel safe going to campus, where else are you going to go? So it'll be interesting to see how things turn out. I know that John Carroll is working very hard to plan for the safety, well-being, and positive educational experience of their students. But that is a really good question, and everybody is expecting lower enrollments this fall. So a challenging year. Thanks for that question.
Yeah, thanks, Paul. And along those lines, I remember getting feedback about a month ago. I believe it was an alum who had a child at John Carroll and one at a large state institution, and both doing online learning. And it was noted, how much more challenging the content was at John Carroll, but also the personal attention that their daughter still received, even virtually from John Carroll versus the large institution. So I think that still applies to some extent about that personal care for the student. Even when we can't be together, it was still delivered by our faculty. So kudos to them.
If I could,
yeah, go ahead.
at the end of the semester, I have to say I was glad that I was with my students in the first half of the semester, because then when we started the Zoom meetings, I actually already had a personal relationship with each of them. And it was interesting. You could tell when some of them were having a hard time, because it was not easy for them to be at home. And I know not just wasn't the only faculty member who did it. I think faculty members went out of their way to reach out to students to find out how they could help, what they were doing. And, you know, given the size of John Carroll, we're able to do that even now in a way that would simply not be possible because of the scale of some larger universities.
We have a few more comments, and we're winding down to the end here, but any last questions, please submit those now. We do have a few minutes left. Tom did submit a question here at Jesu. Did the Eucharistic minister wear a mask?
My understanding is, and in fact, if you go to the website of Jesu Parish, they have published all of the information about how they're going to handle that in their bulletin and in a letter that the pastor just set out. My understanding is that, in fact, or the Eucharistic ministers will be wearing masks when they give out communion. But I could be wrong, but I would say check that website.
Great, Paul, and if you can view the chat feature, there's some nice comments pointed at you, also some very specific questions about preferences for Italian beverages and food, so I'll let you handle those directly. But last call for questions. We're about at 9 o'clock here, and have a few housekeeping items to wrap up. Any final questions? Get them in now. Okay.
Something here about Aperol Spritz or Negroni.
Yeah.
I think he asked my daughters and my wife about Aperol Spritz. All right.
Got it. Well, Paul, thank you so much for doing this tonight. We're excited to have you, and I'll just end how I started. We thank you for your support of the Alumni Association, all that you've done for us. Like back when we started the alumni travel program, and we knew we were going to Italy, you were the first call I made to represent the faculty and be with our alums. And when we launched this online series, again, we knew this would be a great topic, and you were the first call we made. So thank you for stepping up and helping us out. And of course, you're a part of a wonderful lineup of speakers that we have, and I wanted to promote that to everyone listening. We have several more to go, just like this. So next up is one of our alums from the class of 1970, Bill O'Rourke. He's a member of our board of directors. And if you read the spring issue of Onward magazine, Bill was the cover story, reflecting on his experience with the Tree of Life tragedy in Pittsburgh, his hometown. Bill will discuss a little bit of that experience, what he learned, as well as his upcoming experience, a project with the United States military, and kind of under the umbrella of his main theme of leading with integrity, which is something he does quite well. So Bill will address our alumni on Wednesday, June 10th at 8 p.m. All of these are at 8 p.m. That's Wednesday, June 10th. We'll have a yoga session on Saturday morning, June 13th at 8 a.m. And then we come back to the evenings with Dr. Andy Welke, who I believe is on tonight listening in, probably taking notes. So hello, Andy. Andy will give the economic impact of COVID-19, kind of a forecasting of our economy, projecting forward, where we'll be, where we're going. That's on Thursday, June 25th at 8 p.m. And then finally on the books, the political impact of COVID-19 with Dr. Colin Swearingen from our political science department. That's July 7th at 8 p.m. We are angling to firm up one more late July session with members of our Russert department, the communications program at John Carroll, Dr. Peggy Finucane, Brent Brosman, and a special guest, an alum who works in the media. We're about ready to firm that up for mid to late July, so be on the lookout for that. You can register for all these events on our website. And as always, if you have any questions or comments, please contact us at alumni@jcu.edu. Find us on the web. We're not at our office desks and phones anymore, so email is the best way to get us. And we hope to hear from you. Any comments, questions, critiques, any ways we can do better, let us know. But we sure hope you enjoyed tonight. So thank you all for being here.
Thank you. Thank all of you. It's so great to see you.
Thanks, Paul. The thank yous are rolling in, too.